Welcome to Around Town, and we are delighted today to be at the Nash Breast Care Center, and we are joined by Dr. Ken Crosby and Sterling Grimes, Director of Specialty Services, and you're a radiologist, and you are fellowship trained, which is, Sterling's going to tell us, or maybe we'll get you to tell us what that means. But welcome to Rocky Mount. You haven't been affiliated with Nash UNC very long, have you? UNC, yes.
Yes.
But Nash, not so long.
That's correct. I started working here in July, so I've been here almost a year now.
Good.
And I originally trained at UNC in radiology, and then I did a fellowship in radiology, specifically with breast imaging, for a year as well before coming to Rocky Mount. So I'm glad to be here.
We're lucky to have him.
It's a wonderful place to work.
Absolutely, and I'm going to brag on you because a good friend of mine from childhood who is in radiology at UNC, I told her that I wished that people could occasionally be able to go to UNC to get another backup imaging or something if they had a suspicion. And she said, well, you're getting Dr. Crosby, so you're getting the best of the best right there. So, Sterling, aren't we lucky to have attracted him here?
We are. And he was actually our second breast-trained fellowship radiologist to the community. We got Dr. Todd Goodnight in January of last year, and then Dr. Crosby in July. So, and with the new UNC affiliation in April of this year, it's perfect marriage here.
Well, we really want women in this area to have excellent care, and I guess occasionally there'll be a man who will get breast cancer, not nearly so much so, but was one of the things that attracted you is there is a significant number of women who do have breast cancer here, and it's detected in later stages, so it's successfully treated, right?
That's right. So Nash and Edgecombe County have a very high rate of breast cancer. It's not only a very high rate, but also a very high mortality related to breast cancer. And so I was excited to get the opportunity to come work here along with my colleagues and Dr. Goodnight. We are hoping to make some sort of dent in this discrepancy and high mortality that we see in this area. We're not sure exactly why it's that way, but we're doing genetic testing, so maybe there's some sort of genetic link that's causing this problem, or is there something about, the environment, or is there something that we are just not able to identify just yet? I know there's still a lot of fear and phobia related to breast cancer itself and just the diagnosis, as well as people not wanting to necessarily know, so they wait until they are too far along to have successful treatment. So hopefully we can figure out a way to treat, diagnose, and get people in this area on par with what's going on around the country.
Well, and I think this area is higher than in North Carolina in general's rates and higher than national rates. So
That's right.
The 16th highest in breast cancer mortality in the nation is Edgecombe County.
That's right.
So, and obviously Rocky Mount is sitting on top of Edgecombe and Nash County. So it's really important to reach the women of this community.
well, and we'll just throw it out there. Women don't like to have testing. I mean, it's a fear that every woman has. And
Absolutely.
I know when it comes that annual time to get a breast exam, a mammogram, I dread it.
Yeah.
But I also know that if I can catch something early, or if there's something and we get it checked, 80% of cysts are not cancerous.
That's right.
That talk to us about why it's so important to have those annual screenings.
So annual screenings are important for a couple of reasons. The main reason is that early detection is the key to treatment and survival in breast cancer. So if we can find something early before a patient might feel it or before it metastasizes to the lymph nodes, we have a much better chance of treating someone. So yearly screening is what has been recommended. There, of course, are a lot of studies that say maybe every couple of years or maybe no screening at all is recommended, but right now the current recommendation is yearly screening. And for that reason, we hopefully can catch it sooner, treat it faster and more aggressively, and hopefully save lives in the process. So that's the main reason. Early detection is probably the best treatment, or the best treatment for most cancers in general, not just breast cancer.
And Sterling, y'all have worked really hard here to have it patient-friendly. Tell about some of the speed with which one gets feedback, how quickly the radiologists look at your images and that type of thing.
And Dr. Crosby, feel free to chime in, because when a patient comes in for a screening mammogram, the patient gets their results usually within that week, first few days after. What is really special here at NASH, though, if a patient comes back for a diagnostic mammogram or breast ultrasound, they see a radiologist on that same day. Mm-hmm. That is unique. That is university level. That doesn't happen in our community. Mm-hmm. It's what this new team brought to the table. So we're really excited to offer that. So if a patient has a screening mammogram and has to be called back for a diagnostic, there's already anxiety there, mm-hmm. but we can alleviate the anxiety that day of the diagnostic by allowing the patient not to just see the technologist, but the radiologist. Mm-hmm.
And you just seem like such a friendly person that I bet the patients love him, don't they? Mm-hmm. Mm-hmm. And that's important too, because one needs to be comfortable. And you're married, you've got a family, and I mean you're just kind of like one of us, but you're more highly trained and you're able to do things to really make a dent, like you said, in our community and healthcare in our community. For people who are not prone to come, I mean, are there some things that are offered here now, like if they have any family history of it, or if they've never had one before, can you kind of allay some of those anxieties?
I think a lot of the anxiety, again, is probably based on the fact of, just fear about the diagnosis itself, or have already gone through some family situation where the family member may have had breast cancer and they're afraid to find out themselves. Sometimes people just say they don't like going to doctor's offices at all, and the mammogram itself is uncomfortable. Mm-hmm. So we have technologists here that do a very good job as far as making patients comfortable, mm-hmm. and making sure the exam is not too uncomfortable as well. And we have new technology, hopefully, that will help patients not come back for diagnostics mm-hmm. as often with the 3D mammography that we just recently started.
And that's incredible, isn't it? I mean, we are really, that's big time mm-hmm. to get something like that. You said it can keep from having to people come back, because a lot of people I know always get called back. I guess the density of one's breast can be a provocating factor of that. That's
true. So the 3D mammography can help us see things so the breast is a three-dimensional structure, and it helps mm-hmm. us see the entire breast in more detail, so we can determine some of the margins and boundaries a little bit better. And sometimes we call people back just because of overlapping breast tissue. This helps us see that there's overlapping breast mm-hmm. tissue. We don't need to call you back for that reason. So it does help in that way. So people can have less anxiety about more frequent callbacks, I believe. Mm-hmm. So.
And early detection is the key, right?
That is correct.
For a good outcome.
Absolutely.
Well, thank you for coming here, Sterling. Were you going to say something?
Well, just when you asked about the high-risk patient, uh-huh. every patient that comes in the breast center, and this started about a year ago, completes a health history to see if they qualify or should be considered for genetic counseling and or mm-hmm. testing. And that's really unique too. That's university level mm-hmm. care that we're providing here. So we're excited to be able to offer that, and we do offer genetic counseling on site and testing by our nurse navigator, Penny Hearn.
That's great. So they don't even have to be sent anywhere, and I think a lot of insurances will cover that.
That's right. Mm-hmm.
And to go ahead and know if one has a history that would lead them to be at higher risk, so you can watch it, and then you can talk to an expert such as Dr. Crosby and find out, okay, what do I do now that I know that? Or you can cross it off your list if you don't.
That's right.
That'd be great. Well, thank you. We're going to take a break, and then we're going to be joined by Dr. Goodnight.
Are you just starting out on your own and want to be independent? Do you have a family and need a bigger home? Are the kids moving out? And are you downsizing? First Carolina Realty can help. A 1 or 2 bedroom apartment or house for those starting out. A 3 or 4 bedroom home for a growing family. Rentals, sales, new homes, pre-owned homes, investment property in the city or in the country. Call First Carolina Realty. Now is a good time to make that move. Real estate prices are right, interest rates are low, And there is a fantastic selection of homes available.
First Carolina Realty is a fully licensed real estate firm with offices at 3151 Zebulon Road in Rocky Mount.
If you have rental properties and are tired of the headaches associated with managing them yourself, or if you're looking for a new management team to manage your rental properties, call First Carolina Realty at 252-985-2321. Visit our webpage at firstcarolinarealty.com. We will gladly help you with all your real estate needs.
We're joined now by Dr. Todd Goodnight, Medical Director. You are also a radiologist and fellowship trained. Sterling, Director of Specialty Services. We are so delighted to have young talent at a whole new level with fellowship trained, because Sterling, talk about the rationality of bringing people like Dr. Crosby and Dr. Goodnight here.
Well, like you just said, we were really lucky. Dr. Goodnight joined us in January of last year, and Dr. Crosby joined us in July of last year. And probably the real push came after Susan G. Komen, and you'll have to help me, it was a 2011 report, which, was it 2011?
2007 was the highest, the 16th highest mortality rate, and then the 2011 was the rates of breast cancer compared to national and North Carolina averages.
And that's what we were just talking about, where Edgecombe County was revealed as the 16th highest breast cancer mortality. So there, in our country. So there really was a push to get education training to the residents of Nash and Edgecombe counties. Hence why they're here.
Oh yeah, and to get the 3D imaging, and we mentioned that with Dr. Crosby, but tell us more about what that means. He talked about that what you can detect by it, but then you take those images, and we're going to show the screen where you have a whole room set up where you're examining that. And what are you looking for?
Well, what we do is, you have a 3D structure, and then your traditional mammogram, you put it into a 2D plane. Okay. So now what we're doing is we're imaging in that 2D plane also, but we're adding an arc of imaging. And then we're taking a computer algorithm, we're taking a computer and taking all those images and putting them in super thin slices, like 1 millimeter, which is very, very thin. It's like pages in a book. And we're taking all that tissue in one page at a time, looking at it. And it really lets us sort things out, lets us get a better picture of density and borders of tissue, that's how you find a breast cancer.
And are women with denser breasts exclusively better candidates for that, or should everyone consider it?
Literature shows that there has been no way to kind of pigeonhole patients, like you have dense breasts, you should get it, you have fatty breasts, you should get it. It works for everyone. No
So
matter,
it's a higher level of screening.
for all patients, no matter their breast density.
And Sterling, that was quite a commitment for the hospital, for Nash Healthcare to require that.
We are the only facility in our community. You would have to go to Greenville or to Raleigh to have this, and even UNC doesn't even have tomosynthesis in their breast care center yet. I'm sure they'll get it, but they will get it. But yeah, so we're really excited to have it. It is a small copay out of pockets for patients to have this level of technology, but what's really nice is there are codes that are scheduled to come out in January of next year, because obviously everyone has recognized how valuable it is.
And through Susan G. Komen and some other programs, there are ways that women can have free mammograms, and I think it's part of the preventive screening now that all healthcare plans cover. Is that correct?
Yeah, but most screening, I think, is part of an insurance program. If a patient has difficult circumstances, through the health department, they may be able to get help, and that has some of that grant money in there too. And we just had our fundraiser for the breast center, and some of that money can also be used for women with difficult circumstances.
And we have a strong relationship with the Nash County Health Department and the Edgecombe County Health Department for those patients that are at high risk and don't have insurance, so that we can make sure that we pick that patient up from the very beginning, because the worst thing you want to do is diagnose something and then you can't treat it because there isn't insurance. So we want to make sure that patient if we're going to screen that patient, that we have the resources to be able to care for the patient should something be found.
And this is I think a really important message to get out also. The time where I've seen patients who know that there's a problem, they feel a lump, but they don't get to the doctor. And it's usually these things. It's some sort of financial hardship. And women, they're always taking care of somebody. So it's either they're taking care of their kids or their grandkids or their husband or their parents or their in-law, and they put themselves on the back burner. So, we're really trying to get out there and get the word out. We're trying to help people to have more access so we can get more cancer found smaller. That's our goal.
And it's less invasive, what needs to be done often if it's found very early on, and of course these tools to detect it. I also saw something where when women have calcium deposits, and I think a lot of us have heard that a lot, what's the new equipment for being able to detect that and to treat it and maybe get a punch to be able to biopsy it?
So for calcifications, there's all sorts. There's benign and suspicious. And for the calcifications, what tomosynthesis helps us with is it lets us find the area more specifically and see the cluster a little bit better. Still, the best way to do it is the good old-fashioned magnification views, which Tomo cannot do, but Tomo's best use is as a screening tool. So we want to find the small invasive cancers with Tomo, and calcs they can show up that way. But Tomo is mostly for the small stuff, but it does help us identify it and the area better to better target it for our diagnostic imaging.
And what about ultrasound? You've got some new ultrasound suites too, don't you?
2 new ultrasound machines, top of the line, brand new computer algorithms and work. And what that's allowing us to do is to better characterize lesions, because not every breast mass is a cancer, of course, right? Most of them aren't.
80%. I love that figure. That's my favorite figure.
So it lets us better characterize it. So when we do need to do a biopsy, we can say, we want to be more discriminating on what things we send to biopsy. So if we can rule out something as benign or probably benign, you don't need a biopsy because we have better equipment. That's better for the patient and better for all people involved.
You really like being here. I mean, you left Pennsylvania and came down, but I can tell you've got a real excitement about what you're doing.
Well, to me, this place is I'm a young man, and I'm having such an impact in the community, such an opportunity to help ladies, which has been really great.
When you saw that data came out, and you saw, and obviously, what a great man to look and say this is an area of great need, and that indeed if you can, and I'm confident that you will help bring down those numbers and help.
Well, I think we're doing tremendous work already. I think the community outreach, the administration, the hospital, the board, they have supported us. They know it's a problem. They've been on the forefront with us. Sterling, all the staff here, Terry, Penny, the patients. This is the thing, is everybody knows somebody with breast cancer.
Right. At least one, if not multiples.
And in this community, it has had such an impact that I think it motivates people more to help, their friends and their family and their neighbors. And I really see it. It's been a joy to work here.
Oh, good. And we're seeing younger women get it too than we used to. So,
they've always been there. What I think has happened is with more awareness, we're diagnosing them sooner. And it's been unfortunate, but in the past, I think it was like, oh, well, so-and-so had breast cancer. My aunt had breast cancer. She died. We want to tell the story now. My aunt had breast cancer. They caught it early. We did the genetic test. We did the MRI. We tested her sister, my other aunt, and now we know what to do. Now I'm getting screened. We want to move that diagnosis and help people so they have longer lives.
Y'all listening? It is so important, and you've done a wonderful job making the case for that.
Well, my team has been fantastic. I could never have done it.
Well, great. But we want to, if you're not a lady who's candidate, if you're a man, if you're a son, if you're a husband, if you're whatever, go to the women you care about and tell them you support this and they need to get this done. Absolutely. Thank you.
Thanks.
We'll be right back. Hi, I'm Jean Almond of Almond's Drugs, and I want to invite you to be Almond's customer for your prescriptions. Our average pharmacy wait for your prescription is only 10 to 15 minutes. We have drive-through windows at both locations. We will deliver your prescription free. Our friendly and very experienced pharmacists specialize in consultation, and we are locally owned and have been a loyal part of your community for over 70 years. Just make one phone call to us and we'll make the transfer so we can start taking care of you.
Welcome back. I'm Sterling Grimes, the Director of Specialty Services here at Nash, and we're joined with Jean Kitchen, and now we have Terry Crawford, who's the manager of the Breast Center at Nash. And Terry, you've been here since June.
That's right.
And we're so excited to have you. So talk a little bit about when patients should get their screening mammogram.
Okay, well, normally people think at age 40 you should get your screening mammogram every year after that. But between age 35 and 40, you should get a baseline screening mammogram. And then if you ever have a family member that has been diagnosed with breast cancer, you should get your mammogram started 10 years prior to that. So if your mother was diagnosed at 39, then at 29 you should start getting mammograms, getting your breasts checked, and maybe having some other more pertinent tests like MRI or
And the screening, the genetic testing. I mean, if there's
genetic testing.
If anybody has, what's considered a close relative to generate needing to have genetic testing?
Like your mother, your grandmother, sister would be first degree relatives.
Any one of those?
Any one
I mean,
of
it doesn't
those.
have to be all of them, but
Right.
any one.
Any one of them, yeah.
And that's done right here, as y'all talked about with Dr. Goodnight. And then how quickly does one get results? And I guess you don't just send them, you come and you sit down and tell them what happened,
Right,
what we
that's
found,
right.
and because that's not an easy test to get results
It's
from.
not something just anybody should have done. It really should be a decision that the patient decides with after genetic counseling if they really do want to have this information, and if they have the information, what do they want to do with it. So it's an educated conversation, and it does take several weeks to get those results back. So that's why it's really important that the patient can handle that level of anxiety and waiting for that. But every patient is screened to see if they should consider genetic counseling.
The staff here is so friendly, though, and so supportive. I mean, to have Dr. Goodnight sit there and choose to come here because he wants to make a difference in people's lives, such that, and you were recruited, right, Terry, from where?
From Mississippi, from a hospital in Mississippi. Yeah, and I love it here. And mammography is my passion. I've been a manager for many, many years of Breast Center, and I wouldn't trade it for anything. I love being able to serve the public and do what I do. And it's very important and a very, very worthy cause. So,
Can women self-refer? Do we have to get, I think I read that no longer does the doctor have to call in orders to be able to have a mammogram?
for a screening mammogram, you
Okay.
can sure come up here and tell us that you need a call and schedule your mammogram and have a mammogram for screening. That means you have no signs or symptoms. We do need an order if you have a lump, bump, or pain or drainage. We need an order for that. So, but yes, you can self-refer. You sure can.
And to come and have that, still you recommend that women go to a doctor and have a manual exam also,
Definitely.
correct?
Definitely do not bypass your physician. It's very important to do self-breast exam once a month and yearly clinical breast exam by some kind of practitioner that is practiced in doing breast exam. Very important.
Well, we are in the waiting room on the second floor, building 250, 250,
Nash Medical Arts Mall.
right
Yep.
behind Watson Eye. And I mean,
We usually say look for the eyeball. That's right.
very easy to come in. I've been here for a number of years now, but just walk right up there, sign in. Very friendly staff. Sign you up, you make an appointment. I notice also that once you have one, you're in the system, and so I can call and say, when did I have my last one? Because it's hard to keep up with that. And they'll say, well, it was such a time, so it's about time. Should we go ahead and make your appointment right now? Talk about, Terry, some of the new equipment that we've covered some of it, like the 3D but there's something with a hole in it that one can lay on.
Yeah.
Who uses that? And
Well, that is a stereotactic biopsy table that you saw, and that is for patients that need a biopsy that have calcifications, because calcifications are like little grains of sand, or like trying to find a needle in a haystack sometimes. And this machine magnifies the breast so that we can see those calcifications, and it has a computer system on it, and it has Cartesian coordinates, which helps zero the computer into the correct area. And then the needle goes in and cuts out the cores. We usually go around the clock and take about 6 cores, and then that goes to the tissue pathology, and we get the diagnosis back. And they really recommend now that you have a core biopsy before you go to surgery, because it helps prepare the surgeons and your physicians to know what to expect when they get in there. Whether they're going to need to do a mastectomy, whether they're going to need to just do a lumpectomy, or and 9 out of 10 times the biopsy is normal, and it comes back fibrocystic or sclerosing adenosis or something like that, and that's all you need, and it's no scar. It's no scar, just a little bruising, no scar. So it's really worth it. It's wonderful, very accurate, get an accurate diagnosis.
So we've come a long ways in being able to find things early. The comfort level, I think, it's still not perfect, but it's, it's as good as could be expected or hoped for. But it's so worth it. I mean, Sterling, women really do need to look out for themselves. As Dr. Goodnight was talking about, women take care of other people, but if the woman in there to take care of them because she's sick, then the whole family falls apart.
What's nice about our community is it's rural, but it's close to a university setting, which makes everybody step up their game. So we offer really good care here in a small community because patients have a choice, and our patients are educated. They were calling and asking, when are you getting tomosynthesis? Do you have 3D mammography yet? So, we needed to deliver on what patients were requesting. So we have a savvy community because we're close to great health care, and we offer it here in our own community.
Great. Well, thanks for all you're doing. And I'm sure that when something new comes out, you're going to get
That's
that too
right,
and bring it
that's
right
right.
here to take better care of us. So people can call. How do people call to make an appointment?
Okay, they can call 252-962-6100, and that's our scheduling department.
Great. Well, thank you so much, Sherry. Welcome to the community.
Thank you.
Sterling,
Thank you.
thanks
Thanks,
as
Jean.
always. Have a great day. And if you hadn't had your mammogram, you need it. Take care.